Okay, Nicole, you're unmuted. Can you go ahead and test it out?
Yes, can you hear me?
Crystal clear, perfect. Thank you.
Okay, sounds good.
We'll give it another minute or two and then I'll turn it over to you as presenter after the beginning slides.
Okay, perfect. Thank you.
Great, thank you. I'm gonna go ahead and mute you again. I turned it to her as presenter. Great, good afternoon and welcome everybody to this afternoon's edition of TEL Talks. This is our TEL Talks, our topics for early learning leaders, and we're on our second TEL Talk for the year. My name is Nikki Lepowski, and I will be driving the webinar today before our guest speaker. Just want to go over a few things. Hope everyone made it in safely to their location or working remotely with the ongoing winter wonderland we have. So again, welcome everyone to TEL Talks. Some of you have received some information previously about this, but please feel free to spread the word to anyone that is a program leader that's interested in joining these TEL Talks. As you can see on your screen, these are monthly webinars, and they're really based off of the feedback we received by many of you that are on the webinar today and others in our community in Minnesota that lead programs and are looking to have a solutions-focused discussion. So some of the previous topics that we've had, you can see there on the screen, were related to some of our financial supports, teach and retain. We had conversations regarding courageous conversations and an update on some advocacy efforts that are happening and how you can get involved with the census. We had Achieve as a guest speaker as well recently, and always looking for increased professional development for our directors. So those were some of our previous topics. Those recordings are available, so if you're interested in receiving those, just contact me. My email information is included with the follow-up from each email, and or you can just contact me and we can get that back to you. Just a heads up for some coming up TEL Talks that you'll shortly be invited to. We have a March 19th and an April 16th webinar. In March, we're going to be discussing some licensing points and some information with some representatives from DHS licensing. And then in April, we will be working with the topic of homelessness and families that are experiencing homelessness and how that might impact your work. Oops. So just a brief overview for those of you that are on the webinar that aren't familiar with our Child Care Aware system. Myself and my colleagues that are organizing today's webinar and our TEL Talk webinars are located at the coordinating office for Child Care Aware of Minnesota. We have regional supports and on-site support throughout the state. So you can see a little map there just showing where all the districts are located and the different region borders. In addition to that support, They're also offering some support and assistance through professional development, eager to learn, grants such as regional grants and retain. Of course, our state's QRAS or Quality Rating Improvement System, Parent Aware, scholarships, and then trainer and RBPD, which is relationship-based professional development support. So again, our goal is to create another sense of community to help keep us all informed on the importance of quality childcare and the resources and individuals that are there to help us throughout the state. So our support team for TELTalks are Kylie Cooper and myself, Nikki Lepowski. And then our offline team is Erin Young, Corey Woosley, Katie Hoffman, and Marissa Alberton. Katie is in the conference room with myself today, and then we have our guest speaker joining remotely. Okay. So today our guest speaker is Nicole Redding, and she will just introduce herself briefly, and I will turn it over to her here shortly. Thanks for your patience. All right, Nicole, I've made you the presenter, so in just a second, you should be able to pull up your PowerPoint and display your screen, and you should also be unmuted here as well.
Okay, can you see the screen okay?
Yep, we sure can, thank you.
Perfect. Okay, so I'm Nicole Burning. I work as the Autism Clinical Lead on the Early Intensive Developmental and Behavioral Intervention, or the EIDBI benefit at Department of Human Services. And today I'm going to go through some of the resources that are available to families of children with autism. And hopefully throughout the presentation today, you'll gain a bit of a greater understanding of what autism is, what are some of the symptoms to be looking for, and then what would be some of those next steps or resources that you could offer to a family if they have questions or are in need of additional services and supports for their child. So that's where we'll begin, was just a bit of a background on autism, and then go through some of the resources that are available across the different state agencies, across a variety of healthcare settings that can support a family. And then we're very excited to be able to offer a couple of new resources. There's a new autism resource portal website that's available, and also a pathway to autism services and supports resource that is another great document that you can share with families that have questions. So that's what we'll go over today. So a little bit of background on some of the main characteristics of autism. So really impacting that social interaction and communication component. So if the child has any differences in interacting with other children, difficulty making friendships, maintaining those friendships, if they just don't seem interested in conversing back and forth with other kids, or really engaging in a lot of pretend play or cooperative play with other children, if they tend to, be off on their own, or really resistant to maybe engaging in back and forth play that could potentially be a sign of autism or related condition. Any differences in using eye contact, gestures, so maybe demonstrating some unusual gestures, or maybe not using gestures that typical kids may. So things like not really pointing to objects or pointing things out to other people, differences in their facial expressions, body language, things like that. So all things just to be looking out for. Also, if a child may have difficulty picking up on social cues, so understanding jokes or sarcasm or things like that can often be a sign of someone on the spectrum. Also just little interest in really that imaginative play, so they're really not interested in pretending or maybe engaging in play that you'll see a number of other children doing. So they may be more interested in just lining up the toys or playing with them in a real rigid or restrictive pattern. So leading into some of the restrictive repetitive behaviors, so that could demonstrate itself with the play, or it could also appear as just behavior, so twirling, any hand flapping, anything that may just seem a little unusual, so toe walking, maybe pacing back and forth, just something that is very ritualistic. Oftentimes, if they feel that they have to follow a very specific routine or pattern, so they may want to, walk a classroom in the same pattern. They may have to, come into a childcare setting and put their backpack up exactly the same way every day and engage in the same, activities every day in the same order. And if they are not able to, they may become very upset. So things like that. Also, maybe any unusual touching, smelling, tasting, or just reacting to sounds, different textures in their environment, lighting, anything like that that they may be overly sensitive to as well could potentially be other symptoms of an autism spectrum disorder. In very young children, what we're typically looking for early on is just maybe a limited demonstration of emotion. So, not making eye contact with adults or peers, that lack of waving or pointing that you would see in very young children, that they're really not starting to respond to their name or even an inconsistent response to their name. That would be concerning. And just, really if they've maybe either started to learn speech and then have lost some of that, or they maybe haven't really developed or started engaging in a lot of functional communication, that would be concerning. And really that functional component of the communication is key. So a lot of children with autism, may be very interested in, reciting letters or numbers, or some may even be able to read, but they really are limited to that type of communication, or talking about very restricted interests, but they may not engage in communication such as asking for what they want, or expressing their emotions, or label what they're doing, as you would see typically from a child around that age of 2 or 3. So it's just some of the things that we're looking out for, and always keeping in mind that it is a spectrum. So all of the symptoms and characteristics can really vary from very mild to very severe. So really no two children with autism are going to look the same. So you see any of the presenting symptoms, really encouraging a family to consult with their doctor or pediatrician, to get an evaluation, because we know that it's really that early intervention component that can be really crucial for that child's development. So we really want to make that identification early. Right now in Minnesota, the prevalence of autism is 1 in 42 children. So quite high prevalence rate. So this is why we're really trying to create those resources for families. Within the education system, we see over 20,000 children, or about 14% of children in that 0 to 21 age range, with an educational determination of autism. So just to give an idea again of the impact. Right now, we know that the age of diagnosis, we can identify autism as early as 18 to 24 months in a child. But right now, where we see the average age of diagnosis in Minnesota is almost 5 years of age. So typically, what we're seeing is that the child's not being identified likely until they're going into school or at that kindergarten age. So we would really like to see that move down and be identified earlier so that families and children can access that early intervention right away. So within that same research study that they looked at the prevalence rate, they also looked at it across different race and ethnicity, and there really were not statistically significant differences across race and ethnicity for children. However, where we do see some disparities is in that age of diagnosis. So as you can see within the Hispanic, the Somali, and the Hmong community, that average age of diagnosis just continues to increase. So even more concerning there, that language barrier and just maybe some lack of access to resources and supports in that community can really pose some additional barriers there. So why we're really trying to develop these resources is we've heard from the National Survey of Children's Health that less than 16% of families of children with youth and special health needs really feel that they're experiencing a well-functioning system. Some components of that we would determine to be a well-functioning system might be if the family feels that they're included within the treatment and the part of the services and supports, that they have an identified medical home so that the child is regularly seeing a pediatrician or doctor, that they have access to that early screening, that they have access to adequate healthcare coverage, that they're easily able to access services, and that we're setting them up with resources for that transition period as well. Some of the main barriers that cost of healthcare has consistently been reported by families. Just the different eligibility and availability that varies between counties and in areas across the state can be an issue. So of course there's a lack of resources in a lot of rural communities. There's different rules, regulations, a lot of acronyms within state resources that can just make that confusing and difficult for families to access. Also access to transportation, finding that child care so that maybe that the child can go and access some of these other services and supports. Providers not collaborating together, and also a shortage of qualified providers can all lead to some additional barriers. So what we've tried to really strive to do is bring together the different systems of supports for families, so really across the healthcare setting, the human services field, the educational setting, and then those transition services, really bring together all of those resources for families and help it make it a little easier for them to navigate. So one resource that we've currently launched is the Minnesota Autism Resource Portal. So it's a website that is managed by Department of Education, Department of Health, Human Resources, and the Department of Employment and Economic Development, and really is just a way for people to go and find really all of the resources that they would need in one place. So just really combining all of the information into kind of a one-stop shop for families and providers and other professionals to be able to easily access. So whatever you may be looking for, if it's related to autism, we're really striving to have it available on the website. One of those resources is a free training that we offer to everyone in Minnesota. We encourage this for parents, caregivers, all child care providers, really anyone working with individuals with autism. It's called the ASD Strategies in Action. It is broken down into 3 age groups. There's a toddler, school age, and transition age. And all you have to do is email us at our ASD email inbox and request a free subscription. And you'll have access to up to 40 hours of free online training. So can really give you a lot of great tools and strategies of engaging with someone with autism, and how to be more successful with that. So that's just one resource that's available on the website. You'll also see each main category is broken down into subcategories. So this is just an example under the intervention and services. What you'll kind of find. So hopefully is really making it easy for everyone to navigate. So whether you might be looking at this resource yourself or referring a family to it, or sit down and navigate with them, really a lot of the information that I'm going through today will really all be featured on the website as well. We do also have a feature where if we've missed something, if you find a resource that you feel like would be really helpful for us to include, you can contact us and submit that resource. And if it meets our guidelines and standards, we'll get that added to the website as well. Another great resource that we have for families, we know that initial conversation or approach of bringing up a concern about autism or any developmental delay can be really difficult. And then just any family receiving the diagnosis and having to start that process of accessing services and supports can be challenging. Even more so for a lot of the diverse communities in Minnesota. So a lot of them also struggle with some of the stigma surrounding the diagnosis and just that language barrier. So we have 5 videos that feature families in Minnesota talking about their journey of receiving the diagnosis and accessing services. And these touch on African American, American Indian, Hmong, Latino, and Somali families. And it is in their own language and is accessible and available for families. So those resources and videos are also on the website. And a new resource that we have now is what we're calling the Pathway to Autism Services and Supports. And this, again, also really breaks down the different programs and services that are available across the different settings. So, we were really always hearing that families, they knew what was available to them through their school district or, maybe at the doctor, but they really weren't kind of getting the full picture of what might be available to them, and really hearing about the wide variety of things that are out there that could support them, and that they could actually access across multiple areas. So just because you're receiving speech through your school district doesn't mean that you couldn't also be receiving intensive intervention from a community-based provider. So what we wanted to try and do is get all of those things onto one resource for families and let them understand a little bit about the eligibility, the availability of the programs, and where they really need to start to get access to those things. So you'll see that broken down, and we'll kind of go through a lot of these different services here in the next few slides. But this can be a great resource to have available to share with families if they have any questions, if they would like to know more information about what's out there. We do also have the symptoms and the diagnosis component included on this document, and we also clarify a little bit around the educational determination and the medical diagnosis for families. That can be a little confusing, that the educational determination gets you access to services through the school district, but the child really needs that medical diagnosis in order to access medical assistance and most of those more intensive services and supports through the state agencies. So hoping to give a little more clarity around some of those resources for families. We do know that it is, it's a lot of information. It can be a little overwhelming, but right now we see the audience as educators, healthcare providers, social workers, case managers, and other professionals. We would really like to see it used as a tool to sit down with families and talk through some of the resources that are available. It is available as a printable document, so I included the link there. And we are also working on a parent caregiver version. We're doing a number of interviews with families to get an idea of where the specific barriers were, what was most helpful to them, and then we'll be developing another document specific for them as well. We are also working to translate the current pathway document into other languages, so you should see that coming soon as well. So this, again, is another interagency effort that has been worked on by all the different departments, and we're really just hoping that it's helping to get the word out about what those symptoms are, what's the importance of having that educational determination and the medical diagnosis, and just really clarifying all those different resources in one place. And it can just be really helpful, because I know there's often concerns about making referrals, or people feeling liable for certain things, but this can just be a real easy way to start a conversation with a family, and they can kind of take that and do what they feel is best for their family and child. And we also hope that it's accessible, so no matter what age the child is, that they can really identify, where there might be services and supports that they're not accessing. So going through and asking a family, so what is the child receiving? What are they not? What other things may be helpful for them? Another resource that we recently launched is a cultural responsiveness training for autism service providers. And we really hope that this is going to give individuals a lot more experience and confidence in being able to serve families from diverse communities. The first 4 to 5 sections really are very applicable to all provider types. So we do encourage you as childcare providers, if you're interested, to go on TrainLink and be able to access the cultural responsiveness training as well. It really goes through a lot of effective communication strategies, how to work with interpreters, how to set up the environment just to be sensitive to the needs of culturally diverse communities. So, and then there are, more in-depth into the clinical aspects as well, about doing assessments and treatment planning and things like that as well. But we hope that it is a resource that can help a lot of individuals. It's free. You can access it at any time, and the link is available there on TrainLink. So to go a little bit more in depth about what's available through the public healthcare system, we'll talk about some screening and assessment resources, and then some of the healthcare and treatment options. So first, within the screening and assessment, we really see that healthcare environment where they're identifying those early concerns, they're making those referrals, they're following up with more specific assessments, and then being able to give that diagnosis and potentially offer some treatment to the child as well. So one way that children are often being screened is through the Follow Along program. So this can be a great resource for families tracking those developmental milestones. So really, even as the child is very young and they may not have even identified any issue or red flag at all, it can just be a great proactive resource for families to be able to track those developmental milestones. But then if there are some concerns, there will be someone that can come out and do some additional developmental and social emotional screenings. So they have more information through their link on the website, or you can contact the state program coordinator to give more information for families. And it's really great because then if there is a concern that's identified, they will start to connect families to those resources within the public healthcare side of things. Then for additional screenings, there's the child and teen checkups. So this, again, another preventative healthcare and treatment option. So really helping families to stay on track with those well child checkups every year. For any family on Medicaid, these are free. And there are coordinators available to help them find a clinic, a dentist, an interpreter, any transportation, help locating someone in their network, all of those types of things. So really crucial, especially for a child with autism. A lot of times if the child is demonstrating, challenging behaviors or acting out, a lot of times it could be a sign of a medical condition that the child's just not able to communicate. They're not able to tell you, that they're in pain or something is bothering them. Many children with autism, also have sleep apnea. They can have, difficulty going to the dentist, which then leads to some tooth pain or irritation. Making sure that they are testing the hearing and vision. Any of those medication, if they, are discussing putting the child on medication, if they're, considering a different diet or supplements or any of those types of things, we always want to refer them back to their medical provider for those types of things. Again, if the child falls down, many children with autism have a very high pain tolerance. So they may not come to you that, where that they've been, hurt when they've fallen down on the playground or something. But really just making sure that you're going in and getting some of those injuries checked out, being aware, looking for infections, if there is a change in behavior, a lot of gastrointestinal issues as well, and maybe any allergies. So just always wanting to be really mindful of that, so that we're able to get in and treat those health conditions for them. So some treatment options, we refer families to the healthcare homes, which is an initiative to really bring together more coordinated and collaborative care for them. So if the child is receiving, a lot of different referrals for different specialists, that can get really overwhelming for the family to coordinate all of that. So healthcare homes can help to, coordinate those appointments, coordinate all the follow-up that needs to occur. And they have some more information on their website, and you can also contact them via email, and it'll give you a complete list of all of the healthcare homes that are available throughout Minnesota. And that's where we would see children accessing things like occupational therapy, physical therapy, speech and language, making those referrals out to the specialty care providers, and doing any of the medication management. So we just include the Department of Health's website, and they do also have a specific page on autism spectrum disorders as well. So now moving into the education and public school system, starting off with Help Me Grow, and then we'll move on to the kindergarten through 12th grade. So Help Me Grow, again, similar to the Follow Along program where you're helping the family to track those developmental milestones, but these referrals will connect the family to services through their local school district. So some great things about this, you don't need that medical diagnosis, which can be very helpful because there are often some long waiting lists to access a diagnosis right now. And services will often get started within 30 to 45 days of that initial evaluation. So, so really that quick turnarounds, we definitely would like to see any family, no matter their level of need, to really connect with their local school district and get those services up and going right away if there is any developmental concerns. So for a child birth to 3, they'll work on developing that individual family service plan, and a lot of the services can be provided right there in the natural environment, whether that be the home or the child care center. And those could offer things like pairing the child with some assistive technology devices, offering some additional, maybe occupational therapy services if they're needed, helping with some nutrition services. So often children with autism can have a fairly picky diet, or again, like those allergies could be showing up. So, so any of those types of concerns would be great to also mention and get some additional supports. For a child 3 to 5, those services will now start to be provided more in that preschool or community-based setting, and they'll set the child up with the individual education plan or the IEP. We do always just mention, though, that the amount of different options and programs will vary by each individual school district. So as the child ages into that kindergarten through 12th grade, we do always stress for families that they can request an evaluation at any time. The child just has to always meet that criteria for the diagnosis and show educational need. And then we just give a resource that will connect families to the special education department of their local school district. We also just like to clarify, so this is also found on that document about the educational determination. So within the IEP, that's more of a categorical disability area of ASD. And again, they have to show that educational need, which sometimes can be challenging. Many kids with autism do have an IQ within the normal range, so they may not meet the educational need, but still have a diagnosis. So that's where it's just always, determining what types of services are going to be most applicable for that individual child, and why it's really helpful that they may need to go on and get that additional medical diagnosis. So again, this could open up the door to additional financial support for the family, additional services that they may qualify for now with that medical diagnosis piece. So we do also have another document that helps to kind of break that down specifically. This will be coming out soon for being able to print this document as well. But again, just trying to create as many resources that we can for families and providers. We also have a number of different more advocacy and training resources for families through that educational piece. So the Special Education Advisory Council, those are located in every district. There's also the PACER organization or the ARC of Minnesota. All of them can really help families with any questions that they have, and be able to be, an advocate for them or kind of a liaison between them and the school district. So always helpful to point them towards those resources as well. And the Department of Education, they also have an autism specific page, and then also the special education page has some resources as well. So through Human Services, I'm going to start a little bit about the inclusive childcare component, and then more of those intensive intervention, some of the behavioral health services, the waivers, grants, and just touch on some of the healthcare coverage.
Hey, Nicole.
Yeah.
just briefly before you continue, this is wonderful information, so thank you so much. I did just want to call out to any of the attendees on, if you do have any questions, please feel free to use the chat function. You can certainly save them for the end too, but I know there's a lot of information that she's covering, so if you do have questions, please let us know.
Great, thank you. So we always just want to encourage, if you have a child that's struggling in the child care center, to access some of that support and training that the Center for Inclusive Childcare can offer. We're really hoping that that can be a more inclusive environment, less expulsions for the child to have to leave that childcare setting, just because it can be really difficult to find another space for them to access those services. And then if families are struggling to be able to access affordable childcare, we just include the link to the DHS Early Education and Childcare Program that can offer some of that income assistance for them. So then the benefit that I specifically work on, the Early Intensive Developmental and Behavioral Intervention benefit, under this benefit, we're really striving to see that early screening, diagnosis, and treatment. The services offered under this benefit are very intensive, so we see a minimum of 10 hours a week, but up to, on average, 40 hours a week of services. It's all provided through evidence-based treatment approaches by trained and educated providers, and it can be provided either individually, one-on-one to the child, or in a group setting, small group setting. And we're really trying to see that the providers are teaching the child to functionally communicate, to increase their social interactions, to help give them some more independence. So working on things like self-care skills, safety in the community, all of those types of things that a child with autism, may struggle with. And we really strive to have the services be person and family centered. So very individual goals, very individual to the needs of that specific child and family. So EIDBI is available for anyone birth up to age 21, and they can have autism or a related condition. And we'll go through what some of those related conditions might be. And then a family can be on medical assistance, including Minnesota Care, TEFRA, any of the prepaid health plans, and some private insurance companies also will cover. So other examples of related conditions, this could be things like fetal alcohol syndrome, Rett syndrome, ADHD, Down syndrome, oppositional defiant disorder. So really we feel that as long as the child is able to respond to treatment and make progress, that they can also qualify for EIDBI services. And the services are provided by the agency, but they can be implemented in either a clinic, office, center, home-based setting. The provider can also go out into the community, so that could be anywhere from in a grocery store to Target to a school to a childcare setting. And they can also offer the service via telemedicine for several of the different covered services. So for more information on that, or if you want to refer a family, or if they would like more information, we do have an EIDBI 101 training that's available on TrainLink, and they don't even need to enter in any type of unique ID. If you're not a provider, you can actually just click on the link and go straight to the resource. If you do want a certificate for continuing education, you can sign in through TrainLink. We have those instructions. So currently, right now, we have 66 provider agencies across the state and 96 providers who do that initial evaluation for the service. And as of January 1st, we had served nearly 900 children under the benefit. So if you're curious to see where any of those providers are located, we do have the directory online, and there's also additional info under minnesotahelp.info that will also talk about what types of healthcare coverage the provider takes and what counties they serve, different things like that. This map actually shows where a lot of the services are being provided on the pink map. The blue map shows where there are children diagnosed with autism, so you can kind of get an idea of just where the need is and where the services are starting to grow right now. And we do have a brochure that talks about EIDBI for families, and we do have that translated into Hmong, Somali, Spanish, Oromo, Russian, and Karen. So if any families from those other communities would like information, you can either request those documents through us at DHS, or feel free to just print the resource as well. So just some additional behavioral health services. They can really range from very young children into adulthood, and these can offer a number of different things like psychotherapy services, crisis assistance, respite care, any of those other supports that an individual may need that are kind of increasing in intensity. And we do have access to where you can go to locate any of those providers or refer families to those individual providers. And any of the waiver programs that are available through the county tribes or their health plan, those we would really see for children and families that have kind of exhausted some of those services and supports like EIDBI, and the child is still struggling. They still need a higher level of support throughout their life. So they may be eligible for that waiver program. And those are again determined by the county. So an assessor will come out and assess those needs with the family. And then they may be able to offer things like case management, specialized treatment, equipment, long-term employment supports for the family. So any of those types of things, if those are needed later on in life. There's also a number of grants for families. So specifically the Family Support Grant and Consumer Support Grant. There's a little bit of different eligibility criteria and what those grants offer. But again, if families are looking for some additional financial assistance to access services, those grants might be a resource for them. And I talked about the assessment that would lead to a waiver program. So that's done through the MinChoice assessment. So that would really be what the family could ask for if they call their county or tribal agency. There are also brochures that talk through for a family what to expect during that assessment, because it can be a bit overwhelming. It does take usually 3 to 4 hours to walk through an assessment like that with them. So just some resources available for them there. We also point families to the Disability Hub Minnesota. So this can really be a one-stop shop for any question that they have about really any condition that the child has. So not just specific to autism, and it's not just young children, it can be later on into adulthood too. But they can ask things about like housing, employment, how to navigate the system. They have a nice chat feature that's available for families as well. Any of the healthcare coverage resources, we really encourage families to start with the MNsure website to see what they may qualify for. So we have that link and that phone number there. And just touching briefly on employment and transition services, I know this isn't necessarily very applicable to the very young children, but we do have the resource for Department of Employment and Economic Development that really walk through the whole breadth of services across post-secondary education, being able to prepare them for the community, working on those leisure skills, living skills, all of those types of things. But what we do want to see, even in very young children, kind of preparing them for that transition and employment time period, is that we are encouraging those interactions with peers and adults, building some of those relationships up, helping the child to expand and explore different interests that may lead to an employment opportunity in the future, working on things like empathy, controlling emotions, regulating their emotions, any impulse control, social understanding skills. So all of those things that we see really critical to the early development of the child can really set them up for more success later on, in being able to identify post-secondary education and employment opportunities in the future. For any family that's looking for a personal care assistant, we have the Direct Support Connect website that they can fill out, kind of what type of person they're looking for, and it will connect them directly to a direct support worker. And then there are just a number of advocacy organizations out there, like the Autism Society of Minnesota. They offer a number of skill shops and workshops for families. Also, the Family Voices of Minnesota can be a great resource because they're all families that have children and youth with special health needs. So could be autism, could be other things, but they work as navigators for other families. So really offering that peer-to-peer support. And then I've just included my contact information. We do also have, as I mentioned at the beginning, the general autism email inbox. So you can contact that at any time with any autism related question. And then the response center line. And if you're ever interested in receiving updates and programs, you can sign up for the autism e-list announcement that goes out. So that is all I prepared for today. Are there any questions?
Thanks, Nicole. That was awesome information for everybody, including me. I kept saying to Katie in awe as you were going through the information, wow, this is so cool. Wow, this is so cool. So you definitely did not disappoint. Thank you so much. I don't see any questions on, oh, I spoke too soon. We just got one. Someone just said that it would be great to have these links when we receive the presentation. Yeah, Teresa, we will make sure to get this PowerPoint from Nicole and send that with the follow-up, because there's a lot of links in here and resources that everyone could utilize. We'll maybe give it a couple minutes to see if any questions come up. I don't know. I had a question actually, Nicole, that maybe you could answer, but for anyone on the call today that's wondering, I mean, there were so many resources that were shared that, we'll have to go back and review, which were awesome, but if they, needed to call someone, is this the contact info that you have on the screen right now? Is that where the first place to start would be, or that portal that you mentioned? What would you suggest?
So if they're just concerned right at first that the child may have autism, is that kind of?
Yeah, maybe they've, they need to do some more research themselves or work with the parents. I mean, you could take it any way, but if there's a childcare provider on the call right now, educator on the call right now, and they're just like, where do I start?
Yeah, absolutely. So, I mean, I think the ASD email inbox is always great because we will always, be able to at least point you in the right direction of where the family should maybe be headed next. I think starting them on the path of some of those Help Me Grow and the Follow Along programs can be really good because those can kind of be the gateway to those early services and supports. If they do need to access that medical diagnosis, they can, ask for a referral from their pediatrician to get that specialized referral to get the diagnosis. But But yeah, I think it's always a really, you know, more of the safer route to kind of start with some of the help me grow or follow along. If you're really not sure if it is exactly autism, or if it's just, there's some developmental delays the child is demonstrating, because that can kind of help them evaluate and screen for a number of different conditions, and that type of thing. So
Great, thank you.
yeah.
I don't see any other questions or comments, so everyone is probably processing all the information. We'll make sure to include this PowerPoint on with any other resources you want to go ahead and send me with the follow-up. And we just really appreciate your time today and all the work that you and the partners you've been working with have been doing. So thank you so much.
Well, thank you for having me. I appreciate the opportunity.
You're welcome. Everyone have a great day and watch for the follow-up email. Thank you.